Hi, I'm Alyssa, and I'm a neuromuscular therapist at Cognitive FX. This is Jake. He is also a neuromuscular therapist, and today we're going to be talking with you about eye pain, eye strain, headaches, and light sensitivity that may develop for you following a concussion, and the things that you can do to help reduce those symptoms. Jake will be demonstrating some of the relaxation techniques that we go over today. Many patients that come see us in our clinic experience pain and pressure around the eyes. They also have sensitivity to bright lights, and this can cause headaches. After a concussion, your brain is very stressed and trying to heal. Your eyes are trying to take in a lot of information that your brain has to process so that you can move through your world. It takes a lot of eye movement to scan through your environment, see things, and then interpret what you are seeing. This is a lot of information for your brain to handle, and the processing may be overwhelming. As a result, for this challenging experience for your brain, it leads to pain and pressure and headaches around the eyes. The eye muscle fatigue that you feel in your eyes is similar to fatigue you feel in the rest of your body following a difficult workout. Your eyes are getting a workout too, and this is often the cause of the pain and pressure that you feel around and behind your eyes. As the processing centers fatigue, we become quite sensitive to bright lights. Too much is coming in and hitting the retina, and the brain has a difficult time processing all of that. This can cause people to want to be in a darker room or wear sunglasses most of the time in order to protect their eyes. So there are many things that you can do to help with these symptoms, like vision therapy and a lot of other types of therapy that we do at our clinic. But to start, we can do some basic relaxation and massage techniques in order to try to reduce your symptoms at home. First, we need to take care of the eye muscles themselves. Each eye has 6 muscles that help to move your eye all day long so that you can move through your environment safely. I'm going to show you now a few techniques to massage the muscles to help with tension, soreness, and fatigue so that we can alleviate some of those symptoms. So the first thing we're going to do is I'll have Jake close his eyes and then take your fingertips and gently apply those between the brow and the top of the eyeball. Try to be careful not to press firmly on the eye itself. These are where the muscles live, and we want to try to relax those muscles. So you may work towards the inside of the eye, outside of the eye, below the eye, and above the eye. We want to try all directions. Spend a little bit of time if you find a sore area or an area that feels a little more tight to you. Take the time and massage those muscles. Again, only to the pressure that feels comfortable for you and not too much pressure on the eye itself. You may want to spend a few minutes doing this. Once you feel like things are relaxing and they're not so sore, you may rest. I typically would spend 3 to 5 minutes. Next, we're going to focus on giving the eyes themselves a break from taking in the environment. Okay, so for this one, I'll have Jake close his eyes, and we're going to cover the eyes with the palms of the hand, trying to close off all of the light. So you should see complete darkness here. At first, there may be some flashes, some colors, and some light that you're still trying to take in. This is because the eyes are very tired and fatigued. And when that happens, the brain begins to interpret those fatigue signals as if it's something to see, even though there is nothing to see. I want you to stay with your palms covering your eyes. Once again, no pressure on the actual eyeball, just gently covering over the eyes so that no light gets in. And I want you to sit like this for a few minutes. It is okay if it takes some time. Be patient and give your eyes the time that they need to recover. So Jake here will sit like this until he sees complete darkness, all the flashes, colors, and lights are gone. And once you get to that point of complete black, you may slowly remove your hands and open your eyes. Make note if you feel any different. Oftentimes people feel less tension, less strain, and less sensitivity after doing this exercise. This last relaxation technique can be done as many times throughout the day as you feel like you need. As soon as you feel the fatigue or the pain or the tension setting in, go ahead and take a break from what you're doing. Sit, close your eyes, cover them, and let the fatigue kind of fade away. You also want to, over time, begin to do this more frequently throughout the day and stay on top of it. So begin to do the relaxation before you even start to feel symptoms. Another important time to try this relaxation technique is before sleep. Oftentimes it is difficult to fall asleep. That can be due to eye fatigue as well. So trying this relaxation technique for a few minutes before bed may help you fall asleep a little bit faster. In the beginning, these techniques can be a big help for managing your symptoms, but a visit to our clinic and more specific guidance from our multidisciplinary team will help you make even greater strides in your recovery.